Hi everybody, I am Dr. Pradeep Kumar Shenoy, consultant rheumatologist addressing you from Amrita Center for Rheumatic Diseases, which is located to opposite KMC Attawar. In this video, we will look into three types of lupus or systemic lupus erythematosus. They are drug-induced lupus, minor organ lupus, and major organ lupus. Coming to the first one, that is drug-induced lupus, it is caused by drugs like isoniazid, procainamide, hydralazine, and anti-TNF-alpha agents. They usually produce lupus-like illness, and antibodies which are present are anti-ssDNA and anti-histone antibodies. Coming to the next one, that is minor organ lupus, it predominantly involves two systems, that is musculoskeletal system and skin. Patient usually comes with polyarthralgia and myalgia and rashes in the cheek, that is mala rash, which is photosensitivity. And sometimes the patients can have rashes in the palm or vasculitic rashes in the palm, which usually indicates poor prognosis. Then it is not minor organ lupus. We have to treat it as major organ lupus. The photosensitive rash of SLE, which is usually present in the cheeks, sparing the nasolabial fold, defines lupus. Coming to the third one, that is major organ lupus, it usually involves all the major organs. Apart from that, because of the difficulty in managing, clinically certain manifestations are classified under major organ lupus. It involves heart, lungs, liver, kidney, and the brain. In the nervous system, it produces all the complications mentioned in the neurology textbooks. It produces encephalitis, meningitis, meningoencephalitis, headache, psychosis, polycranialitis multiplex, mononeuritis multiplex, and transverse myelitis and Guillain-Barré syndrome. And coming to the heart, it produces limb and sac endocarditis. Here, it's a sterile thrombotic vegetation which is seen in the mitral valve as well as the aortic valve. Differential diagnosis here is merantic endocarditis. So when this is present, one has to look for antiphospholipid antibodies. Coming to the heart, as I mentioned, we can see all these problems. Now, in the lungs, it produces shrinking lung syndrome. That is, there is loss of lung volume, but there is no damage to the lung parenchyma. This is because of inflammation of the lung parenchyma and decreased mobility of the lung parenchyma. In some patients, elevated diaphragm has been demonstrated. In the abdomen, it produces pancreatitis and leukodhepatitis and abdominal vasculitis. And last but not the least, hematological manifestations like hemolytic anemias and thrombocytopenias are classified under major organ lupus because they are difficult to manage and the complications can be severe. So this video is framed based upon the questions asked by my patients and different individuals over phone. So this would be the last episode for the time being regarding SLE or systemic lupus erythematosus. Further videos I will shoot based upon the phone calls I receive. Thank you. Thank you very much.